Over the past 20 years, assisted suicide has become one of the most ethically challenging and complex topics confronting physicians around the world, rendering it illegal in many nations. Assisted suicide is defined as suicide committed by someone with assistance from another person, especially a physician, though the physician's assistance is usually limited to writing a prescription for a lethal dose of drugs, which the patient can take whenever they feel is right. Assisted suicide should be universally legalized because it allows terminally ill people to have autonomy, relief from suffering, and guarantees a humane and dignified death. Autonomy is the freedom to choose and self-govern oneself. However, while a physician must treat the patient has the right to decide whether or not to be treated. In and of itself, a terminal illness does not impact one's autonomy or the freedom to choose. Towards the end of one's life, the patient has the same rights as an otherwise healthy person. As a terminal illness progresses, a patient's autonomy slowly decreases due to a decline in a patient's physical and cognitive abilities. Terminal illness may affect motor skills or the ability to speak. Hence, patients must be aware of and able to exercise directives or options while still capable of doing so. Just as in life, patients want to remain in control when confronted with a diagnosis that will end their lives. Fundamentally, medicine's objective has always been to relieve patients' suffering. Existential suffering is common among terminally sick people. As a result, it is one of the reasons why some patients seek physician-assisted suicide. While there is a perception that physician support in dying is not an obligation, it may be suggested in the notion that a physician must honor and respect a patient's decisions, provide comfort, and reduce suffering. Assisted suicide is only legal in a few countries, notably Switzerland. Many people travel to Switzerland to seek physician-assisted suicide due to its permissive legislation. For example, Craig was a 59-year-old man who was diagnosed with ALS, an aggressive degenerative neurological system disease. This diagnosis led him to seek assisted suicide in Switzerland, where he would complete physician-assisted suicide by taking a lethal dose of pentobarbital. Despite the aggressiveness of his illness, he remained strong and insightful until the end.
And a lot of the statements you read are like, most people have a peaceful death. That's fine for most people. What if I'm one of those who doesn't? What might look peaceful from the outside does not necessarily reflect the internal mental state of the person. Let's face it, when you're completely paralyzed, can't talk, can't move your eyes, can't move your arms, how do you let somebody know you're suffering? They look at you and you're stilled, and usually we associate suffering with people kind of rolling around and going, ow, ow, ow. There's none of that. Gee, it must be peaceful. Well, no, it doesn't have to be peaceful. This could be a complete and utter hell.
While many suppress the suffering they experience through palliative care, where one is cared for until their eventual death, some would prefer not to face the suffering. Each individual should have the opportunity to choose the course they want to take in their medical care, which is why relief of existential suffering through assisted suicide should be a legal option, as it gives individuals the ability to make the decision right for them, such as in the case of Craig. It is frequently argued that just as individuals have the right to live with dignity, they equally have the right to die with dignity. At the end of life, a considerable loss of dignity occurs. A significant portion of terminally sick patients are given end-of-life treatment in an intensive care unit or ICU. ICUs can help patients experience severe symptoms and endure less pain and suffering by providing a large number of trained nurses and administering fast-acting medications. However, researchers find that dying in the ICU is miserable, with 41% of patients reporting severe pain and 33% feeling a major loss of dignity. Dignified death includes dying in peace, keeping bodily integrity, and dying on their own terms. As the terminal illness develops, the possibility of a dignified death decreases. Certain medical illnesses are so severe and persistent that palliative care is no longer feasible. Physical and cognitive capacities will deteriorate as the terminal illness progresses, affecting the ability to preserve bodily integrity. Losing one's sense of self as terminal illness progresses reduces the likelihood of a dignified death. If given a choice, no one wishes to undergo that kind of decline, which is why assisted suicide should be an option. In conclusion, assisted suicide, despite being a controversial topic, should be legalized universally, as assisted suicide gives people the ability to choose and actively participate in their end-of-life care. Patient autonomy gradually diminishes while living with a terminal illness, making it difficult for individuals to maintain control and make their own decisions. Existential suffering is common in terminally sick individuals and affects one's quality of life. When faced with existential suffering by a terminal illness, healthcare providers focus on pain management and quality of life rather than survival, where suffering is still experienced. Individuals frequently uphold the belief that people have the right to live and die with dignity. In the end-of-life care, loss of dignity is significant, as individuals will experience a deterioration in physical and cognitive abilities. The universal legalization of assisted suicide ensures that individuals can determine what they feel most comfortable with, allowing them to have the opportunity to live out their end of life as they wish.